Hey, everybody, and welcome to another edition of Health Matters. So glad to have you along with us. We have a lot to talk about today. We're going to talk about the shutdown and its impact on North Carolina just a little bit. We're going to talk about veterans and family support. And of course, November is Diabetes Awareness Month, so we're going to talk about that. And as always, we are super excited to have the Secretary of the Department of Health and Human Services with us, Dr. Dev Sangvi, to kind of dig into all of these topics for us. How are you, first of all? How are things going?
I'm well. Things are going great. The weather's turning a little cooler. The leaves are turning color. It's excited to get into fall.
It is exciting. Although I have to tell you, the leaves falling on the ground and then having the thought of having to rake those, not my
Oh
favorite
yeah,
part of the year, but
that's part of the season. Yes, indeed.
got to take the good with the bad, right?
That's
All
right.
right, Dr. Dev, let's start with the federal shutdown. And full disclosure, when we record this, it's probably going to change within an hour or even change
Sure.
within a minute because everything keeps moving so quickly. But just let's start with the beginning. How is this shutdown affecting people here in North Carolina? Of course, primarily we're talking about things like benefits that help people get food, like SNAP
Yeah.
benefits, WIC benefits.
Yeah, most definitely. Well, I appreciate you answering that question. We're following the shutdown on a day-by-day basis, just as you said, and in some cases almost hour by hour because so many things are changing and somewhat rapidly. When we think about the impact, we really think about it in two buckets. One is people, and that's the people of North Carolina, the 11 million people who call North Carolina home, and what the impact is going to be. And because there's a furlough element to it, we also think about the 14,000 people who work for DHHS. And so we're thinking about what the impact is going to be on both populations with respect to the type of services we can provide, and quite honestly, how much we can do in terms of keeping people in their roles here as the government shutdown continues. If you look at what we're really focusing on right now, it's the services piece. What we're really focusing on is the impact it's going to have on North Carolina. Probably top of mind is the SNAP program.
Mm-hmm.
SNAP is the Supplemental Nutrition Assistance Program. It's the program that 1.4 million North Carolinians rely on for food. About 600,000 kids, almost 70,000 veterans. That's the program that provides a small amount of money every month so that individuals can go buy nutritious food. What we've learned as we're filming this towards the end of October is that that November benefit that's provided by the federal government, we've recently learned that that's not going to be available. So that's a pretty big impact on the state. What it means is those 1.4 million individuals won't have ready access to the money they were using previously to buy food. It's also going to put impact on things like food banks and other areas where people would otherwise go when they can't find food, either through SNAP or any other benefit program.
What is this putting a big strain on a lot of the food banks and the people who provide help around the area? Because I know we've talked about this before.
Yep.
Those organizations do a great deal to help people kind of fill that gap when that's not there. And if they're strained, then it's going to be worse for people.
Yeah, most definitely. Rodward, they're sounding the alarm. They're worried as well about whether or not they're going to have their pantries fill, whether they're going to be able to meet the demand that's slowly going to creep up over time. So the best thing we can have is to really have the federal government to get unshut down, if you will, to open up,
Yeah.
to reverse this decision. And one of the things that we're doing is making sure when the decision is reversed that we can be as fast as possible to be able to distribute out those benefits when they're made available to us here at the central agency, and then really just distribute them out again to those over 1 million people who rely on it for eating day after day.
What is the best advice for people right now who are, I mean, understandably very, very nervous about what the future holds?
Yeah. It goes back to what you just said around where are the other sources. One of the options, as we talked about, are the food banks. We know that we've heard from other philanthropic organizations, other community organizations that are attempting to do things locally. So really keeping an eye and ear open to what local services they are, and then using the power of story, using the power of impact to talk to decision makers on exactly what the impact of the shutdown is. When we think about government shutdown, we think about government, we think about government buildings. We don't really talk about it on an individual level. And now we can say conclusively when the federal government shuts down, people might not eat. That's a little bit different when you think about maybe a government service not being available or taking longer to process something because there are fewer people working in a government agency. This is very real when you talk about the day-to-day need for food and nutrition.
And it's interesting because that segues right into our next topic. One of the things that I think was startling for a lot of people was to see people in the military standing in line to get food
Yeah,
at food banks because they're not getting paid. I mean, it's a really big deal that
right.
trickles down to so many parts of our
Exactly.
society. So let's talk for a moment. We're coming up here on Veterans Day on the 11th that we celebrate every year. And this is an
Yep.
area that is full of veterans. It's full of military members. And the health department has some great stuff that you guys are doing to help those veterans out. First, let's talk about NC Serves and what that is.
Yeah, NC Serves is a great program. So, first of all, with Veterans Day, as you said, coming up, it's an opportunity to really thank all of those who continue to wear the uniform, who have worn the uniform for their service and sacrifice. And as you know, there are about 600,000 veterans in North Carolina, so a very large veteran population. One of the things we've learned is that first of all, phenomenal skill set among many of those who are formerly in the military. So, as you and I have talked before, one of my areas of focus is on workforce, and the military provides a unique opportunity to skill up, to train up, and we have to do everything we can to figure out how we bring those skills and that training back into the private sector. Speaking specifically around healthcare, we know there are many people who serve as medics and in other healthcare roles in the military. And when they leave service, we've got to figure out how we really capitalize on that experience to accelerate those who have that skill set into those critical jobs that we need. So that's just one example of how we can really support our former servicemen and women. When we really think about the other services we provide, NC Serves is a great platform. It's ncserves.org.
Mm-hmm.
And what it does is it's almost a one-stop shop for individuals who are looking for those community services, the basic behavioral health, mental health services, helping to figure out how to tap into other local services as it relates to housing and so forth. So it's really designed to help former servicemen and women think about how they can capture all those benefits that are available outside of the military.
What are some of the things that they'll be able to see when they get to that website?
What they'll be able to see is the ability to think about if you need options for housing, if you need options for healthcare, other types of community service. It's really a routing platform more than anything else because it is centralized, and you'll be able to understand those services that are available to you locally.
And so you guys have a new thing called Ask Me NC, a campaign that's it sounds like a pretty exciting addition to this. Kind of tell me a little bit about that.
It is. It's a supplement where, for those individuals who are really having to deal with what we can describe as a disconnected system, because everything I just explained to you right now doesn't always work seamlessly as possible.
Mm-hmm.
So that program is really designed to be a program that sits on top of NC Serves, if you will, to really provide additional services and outreach opportunities for those who are particularly challenged because they may be in areas that are resource constrained or otherwise more disconnected when it comes to those services that really work together or work better when they work together.
How long has that program been around? Is it kind of it's relatively new, right?
Yeah. The Ask Me NC is new. In fact, I think it's supposed to launch next month. NC Serves has been around for some time, and it actually has its origins out of Western North Carolina in the Asheville area. What's really unique about NC Serves is that it capitalizes on a program called NC Care 360. That's
Mm-hmm.
a platform that we've used throughout the state to help connect individuals to health related social needs or those social drivers, again, things like food, transportation, and so forth. So, what you're really seeing here is trying to create a model that can work statewide and that then allows individuals to tap into those benefits without having to think about where do I go when I'm in one part of the state, or what do I do if I'm going in from the perspective of a former service member. It really is trying to create a uniform process across the entire state.
Have you guys seen things ramp up with needs from veterans when we're in this shutdown? Not just veterans, but even military members, to be honest with you.
Yeah, most definitely. I think that there is always going to be a vulnerability. I think when individuals are leaving military life and trying to return to civilian life, and we have to do everything we can to support those individuals. I mentioned earlier, 66,000 veterans are on supplemental nutrition, are on the SNAP program. And so while we haven't seen anything yet in the context of the current shutdown, what we know is those stressors out there that affect the population in general also affect our veterans.
we are in some really unprecedented times when it comes to how people are just trying to live and to make ends meet and to keep food
Right.
on the table for their families.
Absolutely.
Do you feel that stress kind of trickling down to what you guys do every day as well?
Yeah, absolutely, Rob. We feel it every day. I see it on a personal level because many of the individuals who are struggling for nutrition services are also those who are struggling for medical services.
Hmm.
And so when we start to see pressures on the Medicaid program happening, and we start to see pressures on the food and nutrition programs and other programs, oftentimes it's the same individuals. So you're exactly right. The
Yeah.
problems compound. You're dealing with individuals who are having challenges with food, who are at the same time having challenges with accessing medical care.
We're going to switch gears a little bit and talk a little bit about the mental health and justice system initiatives that you guys have going on.
Yeah.
I guess the first question is like mental health continues to be a major focus in North Carolina, especially for people who are transitioning out of the justice system. Tell us a little bit about the new women's home in Durham and how that's going to help support women in their communities. This
Yeah,
is
absolutely.
fantastic.
Yeah, so this is called Jubilee Home. So you said it exactly right, Rod, when you talked about transitioning out. So a few things we focused on in North Carolina. We know that individuals, when they're in crisis, need really three things. They need a place to call or someone to call, someone to respond, and a place to go when they need help. And so we've set up a platform statewide. Now, to be fair, it's not in every community because resources are limited, but we've got a pretty good statewide distribution of things like behavioral health urgent care. Of course, there's a 988 line, and there are other things like peer support and mobile units and those sorts of things that go out and meet people where they're at. So, really focusing on individuals who are in crisis. And that oftentimes overlaps with those who are in the justice system, just as you outlined. So the home that you talked about is really exciting. It's called Jubilee Home. It's in Durham County, my home county, and it's designed to really think about what do individuals need so that the transition from being in the justice system is a smooth one. So many of the same things we've talked about before around housing, transportation, how to access health care, if there are benefits for which you may be available, either state or federal, how you are able to access those as well.
And beyond housing, what other kinds of support and services will be available to help some of these great women rebuild their
Uh,
lives?
as I mentioned, access to things like transportation,
Hmm.
peer support is a big one. It's one of the things we've realized is that when individuals can talk to others who have had similar lived experiences, the opportunity to have someone who relates is a really important one for whatever you're talking about.
Yeah, I like how you said it before. Somewhere to call, some person to call. It just makes a huge difference because you feel that
Absolutely.
support there. You
Most
guys have
definitely.
something else you're launching. I love the name of it, NC Fact Program. Tell me about that.
So FACT program is an extension of something called assertive community treatment centers, and this is a forensic assertive community treatment. And what it's really designed is for those who have really significant behavioral health needs. Sometimes we'll call it severe mental illness. And it really takes more of the type of hands-on services that individuals might need who are in those settings. And it really works with licensed professionals, it works with community health workers, it works with case managers to really provide wraparound services for those individuals who are particularly in need when it comes to behavioral health services.
Yeah, I hate to keep going back to the shutdown, but I think it because it affects so many things. Is that having an impact on some of the services that you all are able to provide outside of things like WIC and SNAP?
Yeah, I mean, we're starting to see early signals. It's mostly anecdotal, but I'm pretty confident that the longer there is a shutdown, the more we're going to see challenges here, including things like behavioral health, because the stress starts to get to you after a while. And we know that individuals who are struggling with behavioral health issues, that can often be a pretty fragile balance. And so anything that tips the balance in the unfavorable direction can oftentimes create more challenges.
Yeah, from a broad perspective too, how are you guys addressing the link between behavioral health challenges and incarceration here in North Carolina?
Well, it was a big part of what was focused on. So, about 2 years ago, the state had appropriated a fairly large sum of money to help understand how we can get ahead of some of the behavioral health challenges. And as you know, this is a huge part of what Governor Stein's administration is focused on. How do you provide that comprehensive behavioral health services
Right.
that's available statewide? And so a big part of it is, as you exactly outlined, is in addition to the crisis that I talked about, We focused on workforce. How do you build that workforce up so you have enough behavioral health therapists, behavioral health techs, psychologists, social workers, and so forth? Really figuring out when there is an opportunity to capitalize on the family dynamic as well. What do we do there? Because we know that if a family is struggling or if an individual is struggling, oftentimes the family is struggling. And then getting to what you asked about on the justice side, somewhere around 50% of individuals who are involved in the justice system will have a behavioral health or mental health need, and up to
Yeah.
75% may have a substance abuse issue. So you can see how you really can't address one without addressing the other.
Yeah, and I think that came to light a great deal with the light rail situation, the stabbing in Charlotte. A lot of conversation was had about mental health surrounding that situation as well. I guess how difficult is it to kind of get people to understand about some of the resources that you guys have available with the health department, the things that are out there? People may not realize that there's really help available.
Yeah, there definitely is. North Carolina is a big state in population
Yeah.
and in geography, and it's fairly diverse in terms of what would be priorities in some communities versus others. So it can be a challenge to help people understand what those resources are. One of the advantages we have is we work so closely with county DSS agencies
Hmm.
and other county partners. So oftentimes our best communication strategy is to work with our county partners so they can get the message out.
You think North Carolina's positioned well, like when it in comparison to other states across the country, to handle these kinds of things,
Yeah,
mental
I
health
think one of
challenges?
Yeah, most definitely. When as a provider, as a physician, one of the first things we focus on when individuals are dealing with behavioral health issues is the acceptance that you have a problem, and maybe
Hmm.
problem is too strong a word, or maybe that there is a need out there, addressing the fact that you do have a need. And North Carolina did that statewide. Again, $835 million appropriated by the General Assembly. We continue to thank them for doing that
Hmm.
about 2 years ago. And what that has really done is allowed us to say, okay, yeah, we have a problem. And as I talk to colleagues across the country, they will often cite that even initial step as how North Carolina is ahead of other places because there is not only a willingness to say, yeah, we need to fix something, but we're going to put some money behind it.
And that's a great thing. We need to
Yeah,
absolutely do that. All right,
most
Dr.
definitely.
Deb, we're going to take a quick little break. And when we come back, we want to talk about something else that's happening in November, and that is I said American Diabetes Month, Diabetes Awareness Month. I always say that
Absolutely.
because I'm on the American Diabetes Association board. So we'll take a break, come back, and I'll talk a little bit about that with you and how the state handles dealing with diabetes across North Carolina. All right, welcome back, everyone, to Health Matters. November is Diabetes Awareness Month. And full disclosure, I have been a member of the Community Leadership Board for the American Diabetes Association for about 15 years. Have a family history of diabetes, have been pre diabetic for many years, and then became diabetic just in the last couple of years. So we want to talk a little bit with the health secretary about Diabetes Awareness Month, and I've somehow managed to take my face off the screen. So let's get rid of that. There we go. That's better. So let's talk a little bit about American Diabetes Association, Diabetes Awareness Month. Goodness, I keep saying that
Fair
wrong.
enough. Yeah.
And what the state does to kind of help combat this numbers. I mean, when you look at the numbers, we're talking like what 136 million people either have diabetes or pre-diabetes.
Right.
That is a huge number.
Right. So
What
let's
is?
look at the
Yeah, go ahead. I'm sorry.
Yeah, most definitely. Sorry. So let's look at those numbers from North Carolina's perspective. So about 1 million individuals in North Carolina have diabetes, and about 2.5 million probably have prediabetes. And we can talk a little bit about what the difference is. One of the statistics that often gets lost are individuals who have diabetes who meet the diagnostic definition but don't know it. And that might be as many as 250,000 individuals in North Carolina.
Hmm.
So you're exactly right. This is a fairly prevalent, it is prevalent illness. The fancy term we'll use in healthcare sometimes, it's ubiquitous, it's kind of all over the state. But one of the important things we want to focus on is exactly what you're talking about. As a state agency, one of the most important things across all of what we do is really on this idea of prevention. What can we do to prevent? What can we do to first identify where those risks are? How do we go to those risk areas, whether it's a geographic area, whether it's a particular population? How we to target the intervention so we can actually prevent illness. It's kind of what we do in public health, and it's certainly something what we need to something we focus on in diabetes.
Yeah, the American Diabetes Association across the country, and of course in November we'll be having something called State of Diabetes. I'm
Right.
going to officially welcome you. I know your schedule is very busy, but if you are anywhere near Durham on November 3rd, please stop by North Carolina
Absolutely.
Central to be a part of that. And we talk about ways that the disease impacts not just people financially, but employers financially
Hmm.
as well.
Yeah.
And this year there's a big heavy focus on a big focus, I should say, on obesity. Um, Talk a little bit about some of the things that the health department focuses on when it comes to obesity in the state. I mean, really, this is a problem not just for North Carolina, but it's a problem in the South generally. A lot of people have diabetes in the South, so it's something
Yeah.
that we certainly need to take a look at.
Yeah, most definitely. So if we take a small step back when we think about diabetes and what the risk factors are, you have those non-modifiable risk factors that include things like age, family history,
Hmm.
and genetics and that kind of stuff, where you really can't modify. But then you have those modifiable risk factors, those things you do have control over. And obesity maybe sits in both. There are some parts of obesity that are modifiable through lifestyle, but we also know that there are other things that aren't just entirely related to lifestyle. So when it comes to obesity, many of the things we're focused on is making people aware of the types of things that lead to obesity. So there's the prevention side again around things like diet, how to eat healthy, how to watch portion size. Think about things like exercise. How do you include a lifestyle that includes a lot of physical movement? Because the physical movement is not only going to consume those calories, it's going to help with a lot of other things
Hmm.
with body mechanics and so forth. And then importantly, finding those areas where the ability to share that education is the most challenged. So I go back to what I said earlier, identifying those areas that are most in need. And we know the rural part of our state is really where you start to
Absolutely.
see any of these things magnified. When you think about first of all, there are access challenges in rural areas, which then make it difficult that even if you want to get help, you may not have access to those. But more importantly, is are we be able to get that information out on what it means to eat healthy, what it means to exercise, what it means to get a right amount of sleep. I know you and I have talked about sleep a couple times,
Yeah.
but how do you include the right amount of rest and those sorts of things? So as an agency, we have the ability to identify where those areas are through the data we collect, as well as our screening populations. And we can't ignore the fact that some populations are just going to be more at risk simply because of where they live,
Hmm.
and other things that have made it challenging to either access healthcare in general or information related to health.
It's interesting because I've looked at this for a long time. There's so many. It's such a complex disease, and it has so many effects. You could lose limbs, you could lose your sight.
Yeah.
Certainly you could lose your life. But it really, a lot of times, it boils down to stigma. People have stereotypes of what they think type two, specifically type two diabetes is. They just
Right.
think people are overweight and they're lazy and they don't eat right. But there's so many things like for African Americans, those numbers are a lot higher because clearly there are things like food deserts or access to healthy food, access to places where you can exercise. What resources does the health department have for people out there who are already living with diabetes and people who are pre-diabetic?
Yeah, so when it comes to those living with diabetes, a number of resources available through our diabetes prevention program, something that so even though those are really designed for diabetes prevention, they can help individuals who already have diabetes because the treatment oftentimes is related to what you would do to prevent. Again, how do you eat healthy? How do you manage your
Right.
weight? How do you stay active and so forth? So the good news is the stuff you learn to prevent is also much of what you do to treat. Of course, treatment can also involve medications and so forth. But I want to go back to what you said earlier about certain populations. What I'm really excited about is something we're going to launch called the Minority Diabetes Prevention Program, the North Carolina MDPP, and which a diabetes prevention program that's really targeting vulnerable communities, oftentimes communities of color, really thinking about how do you provide the culturally competent care? How do you look to provide the type of resources that individuals need? How do you have those right conversations in the community, looking at screening and other targeted measures to decrease diabetes? Because we know when you have over 1 million individuals, a one size fits all is not going to matter. You're going to have to
No.
tailor the type of resources you have, not only what you provide, but where you provide those
Yeah,
resources.
it didn't happen the same way for everybody,
No,
so it can't be
right.
changed the same way for everybody. Dr. Sabah, thank you very much. I appreciate you. It's always it's so good to talk to you and catch up and get some great information out to folks. And
Sounds good.
we're going to chat again really soon. And I'm so grateful that everybody tuned in for another episode of Health Matters. Thanks so much, and have a great day, and we'll see you next time. Bye-bye.